And we're live. This is great. So welcome everybody who's watching us through Facebook land and the internet, and those of you who are live. This is actually one of the classes I was so excited about this year because every year I try to think of about maybe 5 or 10 new topics that we've never covered that people have been asking about or we hear people discussing, and this is one of those. We're very blessed to have Krista with us tonight. Krista actually came into our lives via her husband Levi, who used to work in our office. Lincoln Christian alum, go Crusaders. And so I met her when they were dating, and then your life took you to Omaha for a while, yes, where she actually got her doctorate in physical therapy. And when I heard she was back in Lincoln, we were so excited. And so then on top of that, she's actually working for a friend of mine, Dr. Austin Weaver, or not for him, but in his office.
Yes.
Yes.
Yep.
And so he's going to be speaking here next month on lumbar decompression and lumbar flexion distraction too. So these are things that we don't have the room to offer in our office, but I figure if I can find great people who do it in Lincoln, I'm very much happy to have them get connected with our patients and help out, because the pelvic floor is definitely a thing. It's a super important part of your anatomy, and there are things that will challenge that. Changes that we have, like having children, for example, aging, going through menopause, right? All these things like that. So if we don't deal with it, it can be one of those things where can we go from things that are kind of problematic to embarrassing to really like having prolapsed organs, which leads to all sorts of issues. So I'm very thankful that Krista is going to be bringing her expertise tonight to you, and I want you guys to listen with your ears and head very well, listen with your hearts, and if there's somebody that you think about, including yourself, that would like to talk with her afterwards for how to connect with her and partake of her services, I absolutely want to make sure you do that too. So without further ado, let's give her a nice turning point welcome. Krista Gibson, here she is. She's got a, good?
Yeah, perfect. So it's a magnet?
It is a magnet, yep. If you want to pinch your shirt up.
There we go.
Got it?
Yeah.
Okay, there you go.
That way I have my hands free. Okay,
That's right.
Perfect.
I'm going to be watching
That's
for
good.
online questions.
Yes.
Okay, perfect. That'll be great. Yeah, I'm hoping to give a little bit of time for if you guys have questions, and then online questions. That's awesome. Okay, well, yes, thank you for the introduction.
Oh, yes, absolutely.
Appreciate it. And then I actually, have a slide, just kind of a little bit about me. Born and raised in Nebraska, and then I came to Lincoln at the university, and that's where I met Levi, who worked here before. And then, yes, went to Omaha for my PT school, and we always knew wanted to come back to Lincoln because we love Lincoln. I'm married and I had a son who is 16 months old. He's hit his very busy stage of his toddlerhood, so I have to keep up. And we are actually expecting our second, so very, very excited about that, yes. And then, so after my son Noah was born, I wanted to go part-time, and it was always a dream, always something that I felt like the Lord was leading me to do, was to run my own business, to have a cash practice, because then I could have my own schedule and still be a mom. That's my number one job. So, and my business is called Fulfill Function, and like Dr. Lynn was saying, I work, I rent a space from Dr. Weaver, which give him a hard time when he's here in a couple weeks. Okay, so we'll start out just with some anatomy physiology. Some of this goes fairly in depth, so if you want more depth, let me know. If you want less depth, let me know. I'll kind of start with a little more depth, and if I see like your deer in the headlights, I can always simplify. But yes, pelvic floor, oftentimes we don't even like think about it until something goes wrong, right? And then when something's wrong, it's like, okay, I gotta fix this. Whatever's happening, I gotta fix it. So it is a group of muscles, and I have some models here that are just helpful. And I tried to include quite a few pictures as well. But pelvic floor is a group of muscles. It's gonna be, I kind of like to think about it like a baseball diamond. And you can kind of think of these areas on yourself as well. So they're gonna be between tailbone and pubic bone, and then between your sits bones. And all these muscles lay here. The function of your pelvic floor, many functions. I'd say the main thing is if you didn't have it, you wouldn't have support of your organs. Everything would fall out. So specifically women, it's gonna be your uterus, and for men, the prostate. Another function is controlling bladder and bowel function. So that's again where we kind of run into if we're running into dysfunction, we notice those symptoms. And then the cool thing is the connection between the core and the pelvic floor. So your pelvic floor technically is a part of your core, and we'll get into that a little bit more as well. But highly, highly helps you have support in your pelvis, and then functions when you move, whether you know it or not. It typically functions, unless it's running into the issues again, like we'll talk about later, that we notice and something's dysfunctional. You actually have 3 layers to your pelvic floor. Superficial layer, generally I just kind of explain, this one controls your sphincters. So if you're having like leakage, either urine or fecal, that is gonna typically be an issue with more than likely your superficial layer. So those are the ones that kind of hold urine in, or like if you have to pass gas, that's the one that's holding that gas in. It has to contract quickly during coughing, sneezing, laughing, or lifting, because again, it wants to manage that pressure that those activities are creating to avoid anything leaking. Second layer helps with that. First layer, so assists with the urinary continence, additional support to your pelvic organs, but that third layer, that deep layer, is going to be the one that provides the most support. I think my next slide talk about the Kegel. Next slide I talk about the Kegel. So we'll talk about that with your layers as well. Just to give a side note on the layers, when you're doing an internal examination, which is what I prefer, it gives us a ton of information about your pelvic floor. Each knuckle is a layer of the pelvic floor. We kind of work through each layer to feel through tightness, tenderness, feel through strength as well. And we can feel, I'll talk about this with the Kegel, we can feel that squeeze of that superficial layer, and then we can feel the lift of the deeper 2 layers in that internal exam. But like I said, your pelvic floor is a part of your core. So thinking about in reality, this says diaphragm. Your glottis is technically the top. If you think about this being as like a pressure canister, your pelvic floor is like the bottom of that pressure canister. Your core all around is going to be the sides. Diaphragm is the top, but even your throat. So you can close your throat and create more pressure. So a Valsalva creates a lot more pressure than if you're breathing. So that's why like super big power lifters hold their breath when they're trying to lift their max rep. Because you can create a lot of good pressure. So oftentimes we think pressure's a bad thing. Pressure's only bad if we can't manage it. And that's again where we run into the issues of leakage, prolapse, even like diastasis recti, that pressure's escaping, or hernias. You have like inguinal hernias. It's usually a pressure management issue. So thinking about managing that pressure, even just when we breathe, and the function of your pelvic floor when we breathe. Your pelvic floor and your diaphragm work in tandem. So who can tell me, when we breathe in, what direction, you can't answer, what direction does your diaphragm move, up or down? Down, correct. So as your lungs are increasing, I guess you had a cheat sheet back there. As your lungs expand, well, your diaphragm pulls, and that allows your lungs to expand. So when your diaphragm moves down, that's actually going to push your organs down. Pelvic floor naturally just has this stretch to it, and I like to say it accepts those abdominal organs. Then on the inhale, or on the exhale, excuse me, it has a passive recoil back to resting position because your diaphragm's coming up, so then pelvic floor comes up. That is a relaxed breath. We will get into what it looks like to have an actual contraction with that. So I want to give you guys just like a minute. I'm going to have you start out, either have hands on chest and belly. Actually, let everybody start hands on chest and belly. And with this 360-degree breath, we want those hands to rise equally, okay? Sometimes people can be more chest breathers. If you're more of a chest breather, you tend to be like tight in your neck. Some people really are belly breathers, and then that can cause restriction in rib cage, if we have a restriction in the rib cage, that actually sends a lot of pressure down into the pelvic floor. So again, your breath is so important for managing pressure. So switch your hands then to your ribs. If your shoulders allow it, hook your thumbs behind and then fingers wrapping around. And your thumbs should move back, fingers move forward, hands out on that inhale. It's subtle, and the hardest part typically is the back side of that rib cage because we don't see it. It tends to be stiffer. But again, if we think about thinking about your abdominal cavity like a plastic water bottle, if there's dents in a water bottle, the best way to get those dents, that stiffness out, is from the inside out. So that's what breathing does. Gets everything moving better and helps with that pressure management. Last thing I want you to think of, so on that inhale, diaphragm's moving down. I want you to feel, just be conscious of pelvic floor going down, not forcing it down, just subtly lowering. And then on that exhale, that passive recoil back to resting. If you can try this at home, if you are not feeling it, because it's pretty subtle, again, what you can do is sit on your hands. So I like to put like my fingers on my sits bones, and then my fingertips are just on the inside. And that's where your pelvic floor is. You can see here, if I have my sits bone here, and I have my fingertips on my pelvic floor, then you can feel that pelvic floor just very gently rise and lower on that with that breath. Okay. That brings awareness, consciousness to the pelvic floor, because oftentimes it's the mind and muscle connection that we have to work on. So, like I was saying, we'll talk about the Kegel, because back in the day, Kegels were all that was given. So we have to give a little moment for the Kegel. I just like to preface, Kegels are not always the cure. So if someone's super, super tight, giving you Kegels is actually gonna make things worse. Your relaxation is just as important as your contraction. So if my bicep is just always contracted, whenever I have to get out, if I'm forced out into this range of motion, think about like I sneeze or cough, I'm gonna be super weak out here. I'm not gonna be able to handle that pressure. So we have to be able to loosen up those pelvic floor muscles so that they can work through their full range of motion and then strengthen from there. So that's where we do eventually use Kegels, but we have to make sure that we're not getting Kegels too early. So we'll talk about a Kegel a little bit. Cues that I like to give, these are tailored a little bit more towards women. My favorite one, because it addresses all three layers, is thinking about grabbing a blueberry, so that gets your superficial layer, because closing those sphincters, and then lifting that blueberry gets those deeper layers. Another thing you can think about, don't necessarily do this when you're going to the bathroom, but thinking about like stopping the flow of urine or stopping passing gas, or even just thinking about pelvic floor like an elevator. I really like this example on this slide of the line, thinking about the line as like your resting state of your pelvic floor. So when I am doing my inhale, my 360-degree inhale, my pelvic floor touches down into the basement because it has that natural stretch to it. But then if I'm doing a Kegel, the contraction is gonna meet the demand. So if I'm just lifting my son, he's not even 30 pounds, I'm gonna Kegel a little bit, but really only into that main floor. But if I'm gonna do my max deadlift, I'm probably gonna get pretty close to the attic with wanting my pelvic floor to contract. So it's a lot of coordination and control depending on what activity that you're doing. And then with those Kegels, you can kind of practice each of them. And what you always want to do is have that coordinated, controlled release or relaxation as well as a controlled contraction, because the relaxation is just as important as the contraction. Okay, so core, diaphragm, pelvic floor, we've already kind of touched on this. They all work together. They have to be coordinated because we don't want to have leakage of pressure. We want to be able to manage that pressure. They work together to manage that pressure. So I think we don't even think about our pelvic floor throughout our day. Now you're going to. But as you think about it and get more practice and do more with it, it becomes conscious. So it's subconscious now because you're not even thinking about it. But it becomes conscious because you're like, what is my pelvic floor doing? But as we work and practice with it, and this is what I tell all patients, is like, in the moment, it's like, wow, this is taking a ton of brain space and a ton of brain power to think through all of this. But as we practice and get better at it, it eventually becomes subconscious again. Like, I mean, after I had my son, I had to think about it because you're like, what even happened? But now I'm to the point where I'm like, I don't have to think about it as much because I've worked on it and feel more confident with it. Pregnancy does change that though. So the pelvic floor is dynamic. It's constantly doing something, or it should be constantly doing something. It's just, we tend to think of it as static. So when you start doing pelvic floor stuff, I tell everyone, I'm like, give your body so much grace, give yourself so much grace because it is hard. It's simple activities, but they're so, so hard. This is the small print one. So we've talked about managing pressure. And I've talked about how poor pressure management leads to that dysfunction of the pelvic floor or dysfunction anywhere else. Like again, abdominal hernias or inguinal hernias or even like diastasis recti, not having closure after pregnancy. Or I've worked with men who've had diastasis recti as well. It's all just pressure management. So if we have a weak link, that's where we're going to see that pressure escape. And this is where we find those weak links. So leakage, whether that's like incontinence, fecal incontinence or urinary incontinence. I would say like stress urinary incontinence is typically more pressure management, but when you have like overactive bladder, that's a little bit different. That's almost like retraining pelvic floor and retraining bladder. I don't go a lot into that with this, any of these slides, but I'll touch on it here. Your pelvic floor and your bladder have an inverse relationship. So if we have like urge incontinence, we have to use your pelvic floor to tell, so when pelvic floor is on, it tells bladder turn off. But when bladder's on, obviously pelvic floor has to relax those sphincters so that we can urinate. But we retrain that bladder by using your pelvic floor, which is one of my favorite things to do. It's very, very cool. But yes, leakage, pelvic organ prolapse, or I include hernias, diastasis recti within this. Pelvic pain, typically when we have pelvic pain, I mean, it has tailbone pain in here too, and I include over on the right side chronic back pain or hip pain. It's typically because things are tight. When we have stress, actually, fun fact, if you have like TMJ issues or clench, or you even have consistent tightness in your neck, if you're clenching here, you're typically clenching in pelvic floor. And that can lead to tightness, which then that's where you feel pelvic pain. So also with that, I wanted to touch, in that deep, deep layer of your pelvic floor, you actually have hip muscles. So those hip muscles are part of your deep rotators of your hip. So if you have consistent like deep glute pain, also can be pelvic floor, which is very interesting. I'll be doing some internal work with people and they'll feel referral out to the outside of their hip or into their back. So if you've had someone who's had chronic back pain, chronic hip pain, it's like anything I'm doing is not helping, then I kind of keep pelvic floor in the back pocket of like, okay, something going on here that we're not seeing. We talked a little bit about urgency, frequency, those kind of go hand in hand. Constipation, I've worked with a couple of pediatric cases who've had constipation, and those are also cool to work with the kids and see their progress. And then, yeah, I always look at breathing, if you're holding your breath during certain movements and not managing that pressure well, or pressure is going down into pelvic floor, we want to prevent that. Even like upper ab gripping can push pelvic floor pressure down into pelvic floor and cause issues. Or like even that lower belly pooch that a lot of ladies don't like to have. Some of that can be from that lack of rib cage mobility and then over ab gripping. Talked about breathing, and then we talked about the chronic back and hip pain. Yeah, so all in all, I would say key takeaway. Well, number one key takeaway, relaxation is just as important as the contraction. But just seeing like dysfunction isn't necessarily just weak muscles. We want to look at whole body. We want to look at breathing, how the ribs are moving, how the core is contracting, how much mobility you have in your hips. And so that all plays into the coordination of your core and pelvic floor working together, and your breathing pattern plays into the management of pressure. So not just looking at strength, although we do really look at strength, we want to address the tension and everything else that's going on in the body prior to strengthening and getting everything to coordinate and work together. So yeah, what does rehab actually look like? So the exam piece, internal exam is optional, although I like to have it because it just gives us so much information. So like I said, we're able to feel through each layer of the pelvic floor and see which one is affecting your symptoms, and I can even tell which muscle is affecting your symptoms, and then tailoring exercises to that. I'm able to observe, we already talked about this too, of just your hip mobility affects everything, your rib cage affects everything, and making sure everything's coordinated and working well together. With the internal work, it's the same thing of like, oh, my upper trap is really tight. I'm just gonna apply a little bit of pressure to those pelvic floor muscles. We work on some breathing, deep breathing, 360-degree breathing, and get those muscles to release and to relax. And then from there, once tension's taken care of, that's when we can start strengthening through that full range of motion. Also able to give feedback internally to be like, okay, I feel your most superficial layer is contracting, but we're not getting that lift of the pelvic floor. And with that, I test strength. So when I'm looking at strength, I'm looking at, can we contract quickly? That's super important for a cough, a sneeze, to hold in any urine from escaping. And looking at endurance. So that's more like, hey, I'm going on a long walk, and it's towards the end of the long walk, that's when I'm experiencing symptoms. And then just overall strength. Do we get that squeeze and lift of the pelvic floor? Are we needing to work on intensity of that contraction? And then touched on the bladder training for incontinence and overall exercise. Research has shown that if you actually are strengthening your lateral hips, that improves pelvic floor strength. Because again, we have those muscles that are in your pelvic, they attach into your pelvic floor region, that are hip muscles. They're moving my leg. So those are super helpful. If just a Kegel isn't getting what we want, we can look at full body exercise. And that's what I ultimately want to get to, because those are the functional things that we do. Like picking up a grandkid, or going up and down the stairs, or lifting a suitcase overhead to travel on a plane. Those are ultimately the things that we want to get to, and to be able to coordinate all of these structures to work well and healthily to be able to do those things. So I think that is my last slide. That was a lot.
That's awesome.
Questions? Oh, I did good. Yay.
Nice. Yeah, you have 5 minutes for questions.
Yeah. Okay. Yeah. Questions that you guys have. You probably already know all this. Expert.
I've been through it.
Yeah.
Do you work with people like post-surgically?
Yes, I do. Yeah, pre and post. I really like pre, especially if it's anything like pelvic organ. So like hysterectomy or just anything pelvic organ. I like to do it before, because if we can create that mind to muscle connection before, it's just gonna be so much easier later. It's the same thing of like doing quad work before knee surgery, and then going to have that knee surgery, and it's like, okay, I can find my quad a little bit easier. Yes. Or like even women's C-section scars, working through that as well is something, another kind of add-on. Yeah.
Do you work with, do you work with men too?
I do, so I was telling them that I haven't done internal on men. Mainly that's more just a me comfortability, my husband a comfortability thing too. But I'll do like external work, so working through that. So I just won't do that internal exam or internal work with them. But there's still a lot externally that we can look at. Breathing tells you so much. It's wild how much it can tell you.
Oh, we do have an online question.
Okay.
How do you treat constipation?
Can you just repeat the question?
Yes. So the question is, how do you treat constipation? Constipation is typically it's a retention issue, and typically due to tight pelvic floor, and usually that posterior pelvic floor. So thinking like tailbones here. So here's going to be anterior pelvic floor and posterior pelvic floor. So it's typically tightness in this posterior pelvic floor that we work through. Internally, also with breathing, getting that connection to be able to relax, but even working soft tissue to get things to relax. It's also a lot of education. So what does your setup look like when you're sitting on the toilet? Are you breath holding when you're trying to have that bowel movement? Are you breathing and getting, like, again, it's a pressure management where when we have a bowel movement, it's a little bit different. The breathing's just a little bit different, where we actually want pelvic floor to relax and not contract or not come back to its resting state, or just stay relaxed. So working through education as far as setup and what you're actually doing when you're trying to have that bowel movement is really, really important. That's a good question.
We had a question earlier. Did you have a question?
You always hear about the pelvic floor and you hear prolapse and all that. Is it reversible? Prolapse?
So she asked if, she says you can hear you hear a lot about pelvic organ prolapse, and is it reversible? So typically I say we never know unless we try. Some women, yes. Some women might have just a ton of improvements but still have that prolapse. Other women might not have improvements. I have worked with several and have had improvements. Cool story, actually my mom, I don't think she'll mind if I talk about this. My mom had dealt with prolapse for a long time. So I have 3 other siblings, and she had dealt with it for a long time, lots of issues. I'd never known anything about it, and I was telling her about my courses that I took, and she was like, this is a thing. And so she lives out west, and so I hooked her up with someone who was trained in it, and she literally had like 3 or 4 visits, and she's like, I feel amazing. So that's just like a fun success story. And I mean, yes, you hear a lot about pelvic organ prolapse, and it's like, well, what can I do about it? So this is just so helpful. So I typically answer to that question. It's like, you don't know unless you try. But yeah, I have had several women who've had lots of improvement, which is really, really awesome.
So the other question, we had someone who was going to watch online later, and she wanted to come even though she's never had kids or whatever, just because she's like, are there things that women should do before they have babies, or maybe things all people should be doing to keep their pelvic floor healthy?
I think so.
I thought you might.
Yeah. I would say my knowledge, which I don't know what it would have been like if I hadn't have had my education and my knowledge, having had a baby. I feel like my recovery was just so smooth. So the best thing that anyone can do is get in tune with their body and breathe. Just like what we were doing, is getting that rib cage mobility is huge, especially in pregnancy too, to maintain that, because as everything's moving forward, things even want to get stiffer back here. But it's so important to be able to get that good breath when you're in labor and when you're postpartum as well. But I was, yeah, just overall being in tune and aware of your pelvic floor, and you can, it's a muscle group, just like my glutes, just like my shoulders. So strengthening that and being in tune with that is just so important. So that's what I would say, like general population, even males, being aware of that. And yeah, breathing is so important. So important. Yeah, that's a good question too.
Any other questions?
Well,
What could we do for breathing?
For breathing?
Practicing, for what should we be doing?
That's a great question too. So she asked, what should we be doing for breathing? So the main, like the criteria that you want to hit, again, is what we already talked about. So you want to feel chest and belly expansion, but you also want to feel like even back, and especially this back rib cage, that's typically the stiffest area. Different positions. So practicing that breathing in different positions, air rises. So if someone is struggling, I'll just give this example, struggling with that posterior rib cage expansion, I'll have you do like a modified child's pose. So like hands on forearms. I'll even have, if you're really belly breathing, stick a pillow between here and like your thighs so that it kind of restricts that belly so that it has to start expanding here. If you notice one side of the rib cage is moving better than the other, the stickier side, have that side up and lay on your side and get some movement there. And even with all of that, if we're working here, should be feeling pelvic floor moving as well. So again, working on that coordination of it. Does that answer that helpful? Okay. And yeah, different positions, but even like doing it throughout your day, because again, that 360-degree like relaxed breathing should be our normal breathing. So you'll start, now that I tell you this, you'll be doing dishes at the kitchen and be like, am I doing it? Am I doing it? But that's good. That's good. That's what I would say is like you want to kind of catch yourself like, am I doing it? Because again, we're making it conscious to practice it and make it subconscious.
Oh, so people are watching online or even people here in person, how would they get a hold of you if they wanted to work with you?
Yeah, so you can just search my business, Fulfilled Function. It should have my email on there, but my email is just pt at fulfilledfunction.com. And I can give you guys business cards. But yeah, if you look on that website, should have all my information, and then there's even like a schedule button, just online scheduling. But yeah, if you have questions, please email me. If you want to chat on the phone too before an appointment, that's totally fine. I completely understand that. So yeah.
great. Well, thanks for being here, Krista.
Yeah.
I'm so glad you're here. And I just hope that you take away at least one thing, one action step. Maybe somebody you need to share this with too, because it can be an uncomfortable subject, but it can be more uncomfortable to not address it, for sure. So yeah, Krista, please leave some cards here. And I want to thank you for coming here. And I do hope, guys, that you'll take this and run with it. You know, you've got this one place to live in that God gave you for as many years on this planet. Take good care of it, right?
Yeah.
So there it is.
Great.
Thank you so much.
Woo,
Thanks for having me.